There's some less than good news today. If you're looking to get a blood test at the MUHC and you don't happen to live in the right area or have a doctor who practices in the right area, see, as of yesterday, October the 1st, the McGill University Health Center's blood testing services are no longer accessible for people who don't live on the island of Montreal, but as I said, also for patients of family doctors in the city, including, by the way, those working in the neighborhoods close to the hospital. All of this, when the story first broke just a few days ago, last week, we were beginning to wonder what's going on here. And obviously, what we're hearing from the MUHC says, well, it happens to do with efficiency. We want to make things easier. Yet at the same time, a lot of people are scratching their heads, including, by the way, the health minister, trying to understand how, in fact, this is supposed to make things easier, especially in a system that we have now that's as centralized as it is. Dr. Michael Kalin, I think fair to say, a family doctor, and by the way, part of the Département régional de médecine générale, the DRMG, I think is one of those people scratching his head today as well. Dr. Kalin, thanks for being here this afternoon.
Thank you for having me.
Let me begin by asking you that. When I say scratching your head, I mean, some of this just doesn't, at least at first glance, doesn't seem to make a whole lot of sense, does it?
I agree. It just doesn't make sense. It's bad policy, it's bad access, and it's going against everything we hope to accomplish in healthcare, which is making things simpler, making it a corridor of care where patients can access their tests. And this is one step in the wrong direction.
Okay, you're quoted in the story in the Gazette as saying, we're creating little pockets of care that are refusing to work with each other, which just by virtue of that, obviously, as you say, is counterintuitive and counterproductive. How is this happening in the midst of a system that's being rejigged, if you will, to try to avoid these sorts of things?
Great question. First of all, the MUHC is simply following what the CHUM has been doing for the last year. The CHUM has already blocked access. We don't see that as much as English Montrealers, but this has been an ongoing issue. And the Jewish General Hospital also limits their access to specialists only. So we've been seeing this trend towards silos of care, which don't necessarily speak to each other or work together. It's incredibly frustrating. We received a memo on September 9th that the MUHC was going to restrict access to blood tests. And only doctors who work at the MUHC can order these. And then in the letter, the lab writes, tell your patients to go to Click Santé. Well, if I just went to Click Santé a few minutes ago, and I put in my postal code. Of the first 20 options that came up, 18 are private. 18 are private. CLSC Renee Cassin came up at number 9, more than 1 week wait. Benny Farm was at number 20. So this is what the MUHC is telling us. Go private through Click Santé. I find this terrible, aberrant. I feel that it is going against our values. And again, this is a publicly funded institution. Taxpayers pay for the MUHC. I don't understand why taxpayers cannot get blood tests done at the MUHC.
By the way, to your point about going to Click Santé, and we discussed this at the time as well, this idea of don't worry, you can get an appointment there, the proof is in the pudding, right? You go there, you look for that appointment, as you just said, and you did this not long before we began speaking. 18 of those 20 send you to private medicine, to private care, which is exactly what apparently the health system, the health ministers say, we don't want to have happen. We want less and less of that to happen. How do you square that circle?
That's exactly the point. We're saying one thing, but we're doing another. And yet the public services are now driving people towards the private. It just doesn't make sense. Now, I want to say flat out that there are these point of sale-fees. The care score is one, and there's been a great move towards improving access, and they've done that. And I appreciate that. And as a family doctor in the community, we recognize that if we need rapid blood tests, there is now a corridor. And that has been a wonderful development. But at the same time, closing another avenue at the MUHC. So you have a patient who's been going to the same place for blood tests for the last 30 years, or I don't know how long, and then all of a sudden it's closed. Or a patient has a requisition for a blood test, and they want to do it for one doctor, at one place, and another doctor at another. And it's so confusing. I don't understand how this decision is at all making healthcare simpler. In fact, we're scrambling. As a family doctor, we don't know where to send our patients because perhaps they can't go where they've gone in the past. And as a patient, they're just bewildered. The system is so convoluted. Every day, patients come in and say, I don't know what to do anymore. I don't know who to call. I don't know where to go. What's next? Is the MUHC going to say you can't do radiology here because of budget reasons? Is they going to restrict ER access? It's a slippery slope. And I think that once an institution is allowed to restrict access for one thing, it's just a matter of time before they're restricting it for other reasons.
So the MUHC says the goal of the policy, right, was to basically reduce delays for patients. And you're describing a system where it actually increases delays for patients. Am I wrong?
The MUHC memo says, tell your patients to go to Click Santé. Click Santé, 18 out of 20 are driving people private. That's what the memo says. I don't see how this in any way improves patient care.
Okay.
I think that the point of service are wonderful. I applaud the people who are running that. I think that they are scrambling to meet a tremendous need because this is growing because you have institutions like the MUHC that are now denying access.
So let me ask you this. We started, when I'm talking about centralizing, we know about the health minister made this a major point, right, that to basically go ahead and create Santé Québec. I wonder, though, because this didn't get started now. This got started, I guess, with Gaétan Barrette beginning to centralize the system as well. Is it wrong to say this has turned out, beyond just this particular issue we're talking about right now, that this has turned out to be a failure?
When Gaétan Barrette came up with his reform ideas 10 years ago, many of us said this is not the right way to go. In COVID, it was a disaster. We saw deaths as a result of poor management and a poor setup of our system. And now we are further going down this path. We've seen other provinces do it with failure. I just wish that the leaders, the policymakers, would look around and find a policy that makes sense for patients, one where we actually improve health care, not just access. This is not just about quantity. It's not about just getting appointments. It's about doing the appointment right the first time, giving people the best possible care. And we seem to constantly be putting Band-Aids upon Band-Aids on a problem that we just ignore. And that is about the right of every person to have access to a family doctor, to get prompt care. We've normalized abnormal waiting times. In what civilized country do we accept 8-10-hour waits that emergency rooms are chronically running at 150 to 200% capacity, where wait times for simple tests are running in weeks to months, where access to specialists is years now? This is embarrassing. And for a province like Quebec to normalize this, we get more upset when our planes are being delayed and we have to wait in security at the airport. And for this, we'll put great effort and great resources. But when it comes to our health, sitting in the emergency room for 10 hours is considered to be fantastic now. And this is embarrassing. And all of our policymakers should be aiming to actually solve this, not putting another Band-Aid on it, not giving us another acronym. We actually have to deal with it, not rename it.
Last question for you, Dr. Kalin. Do you think this is one of the reasons why we're seeing so many people, you mentioned family physicians, starting to just leave the system altogether?
100%, without a doubt. New graduates, first of all, are being demonized. The profession is being belittled. And now when you do work, they're making it more difficult for you. Again, I had mentioned this earlier. If I'm a specialist, I have different access than if I'm a family doctor. How does that make sense? Why does one doctor have access to testing, but another doctor does not? And as a family doctor, it just, again, shows that we are not respected, despite the fact that we are doing our best to help the system, to help our patients. We are advocates for the system, and we need to be given the resources to succeed. It's just that simple.
Doctor, I want to thank you for your time. Very much appreciate it.
My pleasure. Thank you for having me.